When it comes to sexual health, one of the most common questions I receive from my patients, and one of the most searched topics online, is how long should sex last? It's a question rooted not just in curiosity, but often in concerned comparison and self-doubt. Many people wonder whether their experiences are normal, whether they're lasting long enough to satisfy their partner, or if there's something wrong when sex ends sooner than expected. The truth is, there's an enormous range of what's considered normal, and understanding that is the first step toward both confidence and healthy intimacy. Research gives us some perspective. On average, the duration of vaginal intercourse from the moment of penetration to ejaculation lasts about 5.7 minutes. That's not 5 minutes of foreplay or romance, but the actual act of intercourse itself. So if you and your partner fall somewhere near that number and both feel satisfied, that's perfectly fine. In fact, there's nothing to fix. Yet, surveys show that when couples are asked how long they wish sex would last, the ideal window often lands between 7 and 13 minutes. This tells us that, while averages are interesting, what really matters is mutual satisfaction and open communication, not arbitrary numbers. Still, there are people who find that sex often ends much sooner than they'd like, or sooner than their partner desires. When that happens regularly and creates frustration or stress, it may be a sign of premature ejaculation PE. Before diving into solutions, it's important to pause and reflect. Do both you and your partner want sex to last longer? If you're both satisfied, there's no medical reason to change anything. But if one or both of you are feeling unfulfilled or anxious about duration, that's a good time to learn more about what's happening and what can help. It's also important to remember that lasting longer isn't always the key to better sex. Many couples find that expanding their idea of intimacy, incorporating oral stimulation, manual touch, sex toys, or even non-penetrative play can be far more pleasurable and emotionally connected than simply extending intercourse. Penetration is just one part of the sexual experience. Talking openly about what each partner enjoys, what feels good, and what brings closeness can often do more for a relationship than any physical technique. When we talk about premature ejaculation in a clinical sense, we're referring to a condition that goes beyond just finishing quickly. In medicine, premature ejaculation is typically defined by three main features. First, ejaculation occurs within 1 to 2 minutes of vaginal penetration. Second, there's an inability to delay ejaculation during most sexual encounters. And third, this causes distress, frustration, or anxiety for one or both partners. When these three factors are present consistently, it's considered PE. There are two main types. Primary premature ejaculation is when the issue has been present throughout a person's life, from their very first sexual experiences onward. Secondary or acquired PE, on the other hand, develops later in life after a period of normal sexual function. This form can sometimes be more distressing because it represents a noticeable change in what used to be normal. People with acquired PE often describe that sex used to last several minutes or more, but over time it's become much shorter, sometimes under 3 minutes, and that change causes distress. Interestingly, studies suggest that around 30% of men experience premature ejaculation at some point in their lives, but only about 9% ever seek medical help for it. That means a majority of men are struggling in silence, often feeling embarrassed, ashamed, or resigned to the idea that this is just how my body works. But P is not a personal failure. It's a biological condition with real, understandable mechanisms behind it. So what's actually happening? Much of it comes down to how your body's reflexes and brain chemistry communicate during sexual arousal. Ejaculation is, in essence, a reflex, meaning it's an automatic process controlled by your nervous system rather than something you consciously decide. When stimulation occurs through touch, friction, or psychological arousal, nerve signals travel from the penis to a region of the spinal cord known as the spinal ejaculation center. From there, messages are sent to the brain, which processes the sensation, adds emotional and cognitive context like excitement, anxiety, or distraction, and then sends signals back to the spinal center to trigger ejaculation. In men with premature ejaculation, this communication loop can be overactive or poorly regulated. One of the main players involved is serotonin, a chemical messenger in the brain that helps regulate mood, sleep, and, interestingly, sexual response. Normally, serotonin helps delay ejaculation by acting on certain receptors that inhibit the reflex. But when those receptors don't function properly or serotonin levels are imbalanced, ejaculation can occur much sooner than desired. This neurochemical component explains why some antidepressant medications, which affect serotonin, can help lengthen sexual duration, even though they weren't designed for that purpose. Understanding this physiology can be empowering, because it shifts the narrative from something's wrong with me to there's something happening in my body that can be understood and managed. Just like any other medical condition, PE is treatable. But before jumping into treatments, it's important to know that premature ejaculation doesn't always exist in isolation. Stress, anxiety, relationship tension, or even other sexual issues like erectile dysfunction, ED, can make it worse. For instance, if a man is worried about maintaining an erection, he might rush toward orgasm subconsciously, shortening the experience. Likewise, depression or guilt can interfere with the ability to relax and control arousal. When a patient comes into my clinic with concerns about PE, I start with a detailed conversation, not a test. There's no blood work or scan that can diagnose premature ejaculation. It's what we call a clinical diagnosis, meaning it's based on your history, your symptoms, and how they affect your well-being. I ask about patterns, how long this has been happening, whether it occurs in every encounter or only occasionally, whether it happens with certain partners or under specific circumstances. Often these answers help us understand whether it's more psychological, physical, or both. What I want every patient to know is that PE is not uncommon, it's not shameful, and it's absolutely something that can improve. Many men try several home remedies or online hacks before ever talking to a doctor, but real evidence-based treatments exist and they work. The key is knowing what your options are and approaching the issue with patience, understanding, and communication. In the next chapter, we'll explore the different strategies, both behavioral and medical, that have been shown to help men gain more control, extend their sexual experiences, and rebuild confidence in their sexual health. From simple exercises and techniques that you can practice at home to prescription therapies backed by scientific research, there are multiple paths toward improvement. What matters most is choosing an approach that feels right for you and your partner, one that enhances not just duration, but connection and satisfaction. Premature ejaculation is one of those conditions that's far more common than people realize, yet it's often surrounded by silence, embarrassment, and misunderstanding. When patients come to me with this concern, many have already spent months, sometimes years, trying to manage it on their own. They may have read articles online, tried various desensitizing creams or sprays, or even adjusted their routines to avoid intimacy altogether. What's most heartbreaking is that many of these men assume it's a reflection of their masculinity, confidence, or love for their partner, when in reality, it's a medical condition rooted in biology, psychology, and relationship dynamics all intertwined. Let's take a deeper look into what's actually happening inside the body. Ejaculation is not a matter of willpower or mental control. It's a reflex, much like blinking or sneezing. Once the body reaches a certain level of stimulation, signals travel from sensory nerves in the penis to an area of the spinal cord known as the spinal ejaculation center. From there, messages are sent to the brain and then back to the reproductive organs, triggering the process of ejaculation. This entire sequence happens automatically and incredibly fast, often in a matter of milliseconds. In men who experience premature ejaculation, this reflex tends to activate earlier than desired. One of the main chemical players here is serotonin, a neurotransmitter that helps regulate mood, arousal, and sexual function. Normally, serotonin acts as a kind of brake for ejaculation. It slows things down by sending inhibitory signals. However, in some men, the receptors that respond to serotonin don't function as effectively as they should. As a result, the brake system is weaker and the reflex fires too soon. This is why medications that increase serotonin levels, like certain antidepressants, can sometimes help delay ejaculation. But biology is only part of the story. Psychological and emotional factors play a powerful role too. Anxiety, especially performance anxiety, can heighten arousal and shorten the time to ejaculation. Many men describe feeling on edge during intimacy, hyper-aware of every sensation, and overly focused on not climaxing too soon. Ironically, this mental pressure can make things worse, turning what should be a shared, enjoyable experience into a cycle of stress and self-consciousness. Depression, relationship tension, and even unresolved guilt or shame about sexuality can also contribute to premature ejaculation. This is why treatment needs to be holistic. When I work with patients, I often emphasize that we're not just treating a physical reflex, we're supporting the person as a whole. That's where psychotherapy or sex therapy can make a tremendous difference. Working with a trained therapist helps patients address the mental and emotional aspects of sexual function. For instance, they can learn to manage performance anxiety, improve communication with their partner, and rebuild confidence in the bedroom. Studies have shown that men who combine therapy with other medical treatments experience an 8-fold increase in their ability to delay ejaculation compared to those who try medication alone. Alongside therapy, behavioral exercises such as the stop, start, or squeeze techniques can help retrain the body's ejaculatory reflex. The principle is simple but effective. During sexual activity, when you feel close to climax, stop stimulation and allow the arousal to subside before starting again. Over time, this practice can help you recognize the early signs of ejaculation and gradually extend the time between arousal and climax. Some men also find it helpful to work with a pelvic floor physical therapist who can teach exercises that strengthen and control the muscles involved in ejaculation, particularly the pelvic floor muscles that contract during orgasm. For many, combining these techniques with medical options offers the best results. One of the most common first-line treatments is the use of topical anesthetics, numbing creams, or sprays that reduce penile sensitivity. These products work by decreasing the amount of sensory feedback sent to the spinal ejaculation center, which delays the reflex. Among the over-the-counter options, Promescent is one of the few delay sprays that's been clinically studied and shown to be effective. In one study led by Dr. Kristen Mark at the University of Kentucky, men who used Promescent saw their average time to ejaculation increase from about 6.5 minutes to 11.5 minutes, a significant improvement. Notably, satisfaction rates for both partners rose as well, with the rate of orgasm increasing from 44% to 66%. What makes this particular spray unique is its metered dose system, which ensures consistent application, and its target zone formula, a specialized eutectic blend that allows faster absorption without needing to be washed off. It's discreet, easy to use, and designed to minimize transfer to your partner, which is often a concern with other numbing products. Still, if you plan to engage in oral sex, it's important to wash the area first to avoid numbing your partner's mouth. For men who prefer prescription options, medications like EMLA cream in the United States or Fortisyn spray in Europe are available. Both contain a combination of numbing agents and can be effective when used correctly. These treatments are typically applied 5 to 20 minutes before sex and should be wiped off before intercourse to avoid discomfort or loss of sensation for either partner. However, for those who prefer a more systemic approach, selective serotonin reuptake inhibitors, SSRIs, a class of antidepressants, have been widely used off-label for premature ejaculation. Drugs such as fluoxetine Prozac, paroxetine Paxil, and sertraline Zoloft increase the availability of serotonin in the brain, helping strengthen that braking mechanism. Although they were originally designed to treat depression and anxiety, one of their side effects, delayed ejaculation, has turned out to be beneficial in this context. When taken daily, these medications can significantly extend ejaculatory latency within a few weeks. Still, like any medication, SSRIs come with potential side effects. Some men experience fatigue, mild nausea, or decreased libido in the early weeks of treatment. The good news is that most of these effects tend to improve with time. For men who don't want to take daily medication, there are also on-demand options like clomipramine, taken 2 to 6 hours before sex, or duloxetine, available in some countries outside the US, which acts more quickly. Ultimately, what's important to understand is that premature ejaculation is not a sign of weakness, lack of control, or inadequacy. It's a physiological process that can be managed with the right approach. Whether through therapy, physical training, medication, or a combination of all three, there are effective, evidence-based solutions that help men regain confidence and restore balance to their sexual health. In the next chapter, we'll explore how to apply these strategies in real life, how to work through them as a couple, what lifestyle adjustments can help, and how to approach this journey with patience and compassion for yourself and your partner. Because treating premature ejaculation isn't just about lasting longer, it's about rebuilding intimacy, trust, and confidence in every aspect of your relationship. When men begin treatment for premature ejaculation, the first and most important thing I remind them is that progress takes time, and that's completely normal. Sexual health, like any other area of medicine, is deeply personal and influenced by a variety of factors: physical, emotional, and relational. Expecting instant results often leads to disappointment, but when approached with patience, curiosity, and open communication, treatment becomes not just about delaying ejaculation, but about rediscovering intimacy and confidence. In clinical practice, I often see that once men understand what's actually happening in their bodies, the shame and self-blame begin to fade. Many come in believing something is wrong with them or that they're letting their partner down. But once we break down the neurobiology, that it's a reflex loop governed by chemical signaling and spinal coordination, it becomes clear that this isn't a matter of character or control. It's a condition that can be improved with structured strategies. In most cases, full resolution is absolutely achievable. For many couples, Communication is where healing truly begins. Talking openly about sexual expectations, desires, and frustrations can remove much of the silent pressure surrounding performance. Premature ejaculation often becomes more distressing when partners avoid the topic altogether, leaving both sides feeling isolated or misunderstood. A simple, honest conversation can transform that dynamic. Instead of focusing on duration or lasting longer, shift the focus to mutual pleasure and connection. Sometimes incorporating other forms of intimacy, such as foreplay, oral sex, or use of sexual aids can help both partners feel more satisfied without the constant focus on timing. Beyond communication, lifestyle factors also play a significant role in improving sexual health and ejaculatory control. Regular exercise, especially strength training and cardiovascular activity, boosts blood flow, supports healthy hormone levels, and reduces stress, all of which contribute to better sexual performance. Practices like Kegel exercises for men, which target the pelvic floor muscles, can help strengthen the muscles responsible for ejaculation control. To identify these muscles, imagine stopping the flow of urine midstream. Those are your pelvic floor muscles. Contract and hold them for a few seconds, then release. Repeating this several times a day can improve your awareness and voluntary control over ejaculation. Another often overlooked factor is sleep and mental well-being. Sleep deprivation affects testosterone production, energy, and mood regulation. Chronic stress elevates cortisol levels, which can interfere with arousal, erectile function, and ejaculation. Incorporating mindfulness techniques like deep breathing, meditation, or progressive muscle relaxation before intimacy can make a noticeable difference. These techniques help you stay present rather than becoming consumed by anxious thoughts about performance. Diet, too, plays a subtle but meaningful role. A diet rich in antioxidants, omega-3 fatty acids, zinc, and magnesium supports nerve function and blood flow. Foods such as salmon, nuts, dark leafy greens, and whole grains nourish the body and promote hormonal balance. Excessive alcohol or recreational drug use, on the other hand, can numb sensation or impair arousal control, making premature ejaculation worse over time. For men using medical therapies such as SRIs or topical sprays, it's essential to remember that these are tools, not cures on their own. The most successful outcomes come when medication is paired with behavioral training and mental health support. For instance, I've had patients who began with topical treatments to reduce hypersensitivity while simultaneously practicing the stop-start method and mindfulness exercises. Over time, as their confidence grew and their control improved, they found they needed less medication or none at all. This stepwise reduction is an empowering process. It reinforces that the brain and body can be retrained. There are also cases where premature ejaculation appears secondary to other medical conditions, such as erectile dysfunction, thyroid imbalances, or prostatitis. Addressing these underlying issues often resolves the premature ejaculation as well. For example, men who struggle to maintain erections sometimes unconsciously rush to climax out of fear of losing firmness. By treating the erectile issue with medications like sildenafil, Viagra, or Tadalafil Cialis, we reduce that anxiety, allowing more natural pacing and control. One of the most transformative parts of this journey is the emotional shift that occurs when men realize their condition doesn't define their worth or masculinity. I've seen patients who began their consultations hesitant and ashamed, but after understanding the science and following a treatment plan, they return confident, relaxed, and reconnected with their partners. Many describe how improving their control led to deeper emotional intimacy, less focus on performance and more focus on shared experience. For partners, patience and reassurance go a long way. Premature ejaculation can be distressing for both people in a relationship, but approaching it as a team rather than an individual struggle makes a tremendous difference. Instead of seeing it as his problem, view it as a shared challenge that you're overcoming together. Couples who practice empathy, experiment with different techniques, and keep communication open tend to report the greatest satisfaction, not just sexually, but emotionally as well. Finally, I always emphasize that help is available, and you don't have to navigate this alone. If premature ejaculation is causing distress for you or your partner, reach out to a healthcare professional, ideally a urologist, sex therapist, or pelvic floor specialist. These experts can tailor a plan to your specific needs and guide you through proven treatments safely. Avoid relying solely on unverified online remedies or quick fixes. While tempting, they often overlook the deeper physical and psychological factors that need attention. Ultimately, lasting longer in bed is just one outcome. The true goal is a healthier, more confident, and more connected version of yourself. Addressing premature ejaculation isn't about perfection or performance. It's about reclaiming joy, trust, and ease in your intimate life. When you approach it from a place of understanding rather than shame, healing naturally follows. Remember, sexual wellness is part of overall health, and it deserves the same care, curiosity, and compassion as any other aspect of your body. If you're struggling, know that effective, science-backed help exists, and that improvement is not only possible but probable. With the right approach, patience, and support, you can restore control, deepen intimacy, and truly enjoy your sexual relationships again, because you're absolutely worth it.